Immunotherapy has genuinely changed the treatment landscape for mesothelioma patients in ways that are remarkable. When the FDA approved the combination of nivolumab and ipilimumab, which are known as Opdivo and Yervoy, as a first-line treatment for unresectable pleural mesothelioma, it was described as the first meaningful advance in mesothelioma treatment in 16 years, and for good reason. These drugs have extended survival for patients who previously had very limited options, and they represent a genuinely different and in many ways more tolerable way of fighting this cancer. But immunotherapy comes with its own set of side effects that are completely different from those of chemotherapy. They can appear at unexpected times, and they require their own specific recognition and management. One of the most common and potentially most serious of these is immune-related colitis. If you or a loved one is receiving immunotherapy for mesothelioma, today's video is one you genuinely want to pay close attention to, because knowing how to recognize this complication early and what to do when you do recognize it can make a real difference in how it's managed. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a doctor, and this is not medical advice. But today, I want to walk you through what immune-related colitis is, how it develops, what it looks and feels like, and what the treatment path looks like. Because understanding it fully is the best preparation for catching it early. Now, to understand why immunotherapy causes colitis, you need a brief explanation of how these drugs work. Nivolumab and ipilimumab are what are called immune checkpoint inhibitors. Your immune system has built-in brakes. They're regulatory mechanisms that prevent it from attacking normal, healthy tissue. Cancer cells exploit these brakes, essentially using them to hide from attack by the immune system. Checkpoint inhibitors work by releasing those brakes, allowing the immune system's T cells to recognize and attack cancer cells more aggressively. It's a powerful approach, and in mesothelioma, it's shown real survival benefits. But once those brakes are released, the immune system doesn't always stay neatly focused on the tumor. Sometimes it turns its newly unleashed attention on other tissue, including tissue that's healthy. When it turns on the lining of the colon, the result is called immune-related colitis, which is an inflammation of the large intestine that has nothing to do with infection and everything to do with an overactivated immune response. Colitis is the most common serious immune-related adverse event associated with the nivolumab and ipilimumab combination used for mesothelioma. And the data has been particularly illuminating on just how significant a problem it can be. An Australian study of mesothelioma patients receiving this combination in real-world clinical practice found that toxic effects were more significant than what trial results had suggested, and that colitis was the most common adverse event. A 2024 study of real-world nivolumab and ipilimumab use in mesothelioma patients found that 25% of patients discontinued treatment due to treatment-related adverse events. Research published in peer-reviewed medical literature across cancer types reports the incidence of colitis with combination checkpoint inhibitor therapy at roughly 13.6%. That means about 1 in 7 patients treated with both drugs are going to develop it to some degree. Ipilimumab carries the higher colitis risk of the two drugs, and the risk is dose-dependent. The higher the dose, the higher the risk. For ipilimumab, the onset of colitis typically occurs within the first 4 weeks of starting treatment, while for nivolumab, the timing can be considerably more delayed, anywhere from 2 to 4 months after starting treatment, and in some published cases, even longer than that. Now, before I go on, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, getting back to this colitis, its hallmark symptom is diarrhea, and not the kind of occasional loose stool that many people experience during cancer treatment and who attribute it to medication or anxiety. We're talking about frequent, often watery diarrhea that can be both severe and sudden. Published case reports of mesothelioma patients with immune-related colitis describe experiences of 7 or more bowel movements per day above their normal baseline. And it's sometimes accompanied by fecal incontinence, significant enough to limit daily activities and make leaving home difficult. Beyond diarrhea, other symptoms to watch for include abdominal pain or cramping, blood or mucus in the stool, nausea, and fever. The big challenge is that diarrhea during cancer treatment can have many causes: infection, other medications, anxiety, or dietary changes. So your medical team will need to rule out infectious causes before confirming the diagnosis. Testing typically includes stool cultures, testing for bacterial, viral, and parasitic pathogens, and sometimes imaging or colonoscopy. This step matters because certain infections, including CMV reactivation, can occur alongside immune-related colitis, and the treatment approach differs if an infection is also involved. Medical teams grade immune-related colitis by severity, and the grade determines the way it'll be managed. Mild cases, which are referred to as grade 1, involve a modest increase in bowel movements and can be managed with careful dietary modifications and close monitoring if the immunotherapy treatment continued. Moderate cases, or grade 2, require temporarily withholding the immunotherapy and beginning oral corticosteroids. Severe cases, which are grade 3 or 4, involve frequent incapacitating diarrhea, often with systemic symptoms, and require hospitalization, intravenous corticosteroids, and in the most severe cases, permanent discontinuation of the immunotherapy. For most patients who are treated with high-dose corticosteroids promptly, the medication will bring their colitis under control. As symptoms resolve, a gradual tapering off of the medication over several weeks follows. But not every patient responds. Cases that don't improve after 48 to 72 hours on high-dose steroids are classified as steroid refractory, and the current consensus guidelines from the NCCN, ESMO, and the Society for Immunotherapy of Cancer recommend escalating to additional immunosuppressive agents. Even the most refractory cases have treatment paths available, and it's not uncommon for a mesothelioma patient whose colitis fails to respond to steroids and one medication to be switched to another class of drug and eventually achieving a resolution of their symptoms. If grade 3 or 4 colitis is confirmed, immunotherapy is typically going to be permanently discontinued. And that's a genuinely difficult reality when the treatment may have been providing meaningful benefit. Your oncology team will work with you to identify the next treatment steps, which may include chemotherapy or the pembrolizumab plus chemotherapy combination that's been approved for unresectable mesothelioma since 2024. The most important message from everything in today's video is this: don't minimize changes in your bowel habits when you're on immunotherapy. Significant, persistent diarrhea should never be attributed to something minor without a medical evaluation. The difference between grade 1 colitis that resolves with monitoring and grade 3 colitis that requires hospitalization is often the speed with which it's caught. To review, immunotherapy colitis is a common and serious immune-related adverse event associated with the nivolumab-ipilimumab regimen used for mesothelioma. It develops because checkpoint inhibitors can turn the immune system against the colon at the same time that it's battling the tumor. It primarily presents as frequent diarrhea with abdominal pain, and it should be reported promptly. It's treated with corticosteroids, but adding biologic agents for steroid refractory cases is sometimes needed. You can visit mesothelioma.net for resources on immunotherapy and mesothelioma and managing immune-related side effects. Or call us at 1-800-692-8608 or use the live chat feature on our website to speak to one of our patient advocates right away. As for me, remember to post your comments below, and I'll see you next time.